To finish my presentation, I want to talk a little bit about the needs of New Hanover Regional Medical Center and New Hanover County in general for the migrant population. Pender County actually has an abundance of resources, although a lot of them are voluntary resources, staffed with a lot of volunteers and interpreters through that. Um, they still have a plethora of resources available at their hospital as well. However, New Hanover Regional Medical Center, Nora and I spend a lot of time together talking about the needs of the population at NHRMC. And a lot of times these families come through the ER and come to be admitted. And when they're discharged, half their instructions are in English versus Spanish. And the interpreter is not allowed to say, hey, here's some extra resources. They have to stick to only interpreting what the medical professionals tell them to say. So there needs to be an implementation from the social worker aspect, where maybe the interpreter and the social worker work together, and a discharge planning team where maybe a follow-up appointment is already made for these families. They're given these phone numbers, but sometimes they don't have a phone to call. Sometimes if you tell them when to be there and where to be, they will show up versus going home and forgetting to make a phone call or whatnot. So it's really important that to better serve this population that we do get a better discharge planning put in place so that maybe they don't have as many ER visits, and they can start seeing a primary care provider that can care holistically for the family. And that's where we come in contact as future practitioners. Is it's important to give them the resources to get to us. So if as future practitioners, they don't have the resources of who we are, where we're located, and how to get there, then we're not going to see these people out in the community. They're going to continuously come back to the hospital. So as providers, if we are working in the hospital, it should be our obligation to ensure that we get proper follow-up for these families to hopefully limit these emergency visits and start managing their care holistically. This goes as far as medication assistance, making sure that if we're seeing these people outpatient, if we're seeing them inpatient, that these families know what medications they should be taking, or their children for that matter of fact, and how often they should be taking it, side effects to watch for, and where can they get this medication from. So you call it into a pharmacy, give them a map that shows them how to get there, and how often they should be picking it up. So there's definitely a disconnect in discharge planning in the current situation in New Hanover County, from what I saw from my fieldwork experience and from what Nora sees on a day-to-day basis at NHRMC. I do know that some social workers are working diligently to put together packets to hopefully better serve this population. And I feel that as future practitioners, it's our responsibility to make sure that all needs are met holistically for these patients. So not only caring for them, but discharge planning and primary follow-up for them. So although there is a large disconnect, there is room for improvement for sure. And at NHRMC in particular, Nora and a couple of the social workers are working very diligently on getting something put in place. And as future providers, I think it opens a door for us to help provide care to these families in the outpatient setting versus in the inpatient setting.